Hi, everyone. I'm Dr. Michael Richman, double board certified cardiothoracic surgeon. So I've been asked by several of you, what is the reason that we're seeing really so many new cases of colorectal cancer? Well, in response to that, I think the question that really needs to be asked is, are we really seeing it or are we just hearing about it more? Well, the only way to figure it out and explore it is to actually look at the evidence-based data because that's all that matters. So that's what I'm going to talk about today. In addition, I'm going to talk about key contributing factors to the development of colorectal cancer. So, colorectal cancer incidence in the general United States population has decreased overall. Surprising, right? Not increased. The age standardized incidence rate has declined by 46% between 1985 and 2019. This overall decline is driven by the fact that older adults, and we consider older 65 and above, have the highest absolute rate, and their steep decline, which is 3 to 4% annually, outweigh the increases in younger populations when calculating age-adjusted rates for the entire population. Overall declining trend masks a critical divergence by age group because rates are decreasing in adults 65 and older. They've been stable in those 50 to 64 since approximately 2011, 2010, and increasing by 2% annually in adults under 50 years of age since the mid 1980s. So the pace of overall decline has slowed dramatically from 3 to 4% annually in the early 2000s to just 1% annually in the past decade, precisely because rates are rising or plateauing in middle-aged and younger individuals. So now let's talk about why the increase is confined to younger adults. Well, the incidence in younger population reflects a birth cohort effect rather than a period effect. So what that means is individuals born after 1950 face progressively higher colorectal cancer risk rates throughout their life compared to earlier generations. And this generational shift indicates that environmental and lifestyle exposures affecting post-baby boomer generations are driving the trend, not changes in screening or diagnostic practices, which actually would affect all ages simultaneously if you think about it. So why are we seeing an increased number of cases in younger adults? I know that's the big question, and that's what most of you are interested in. Well, the key contributing factors to younger adult increase are as follows, and this is what we know. One, dietary patterns. So Western diets are high in processed meat, red meat, refined grains, and sugar-sweetened beverages, and that shows a strong association, not causation, with early onset disease. Each additional daily serving of sugar-sweetened beverages in adolescence, so about age 13 to 18, 19, was associated with a 32% increased risk. Now a word about fiber, which I know many of you want to know. Prospective observational studies have shown that higher dietary fiber intake is associated with reduced colorectal cancer incidence, though the strength of this association varies depending on the type of fiber and the study method. However, randomized controlled trials, which are the gold standard of fiber supplementation, have not demonstrated a protective effect against adenoma recurrence. So, for those of you who don't know, colorectal adenomas are precursor lesions to the majority of colorectal cancers, and approximately 80 to 85% of colorectal cancers evolve from conventional adenomas through the well-established adenoma to carcinoma sequence. However, only a small percentage of individual adenomas actually progress to cancer. Okay, now, in contrast to the observational data, randomized trials, and I said those are the gold standard of fiber supplements, and those are psyllium and wheat bran, failed to reduce recurrent adenomatous polyps. And that's led the American Cancer Society to recommend obtaining fiber from whole plant foods rather than supplements. Surprising, right? And this discrepancy may reflect differences in fiber types, dosages, intervention durations, or the possibility that whole grains contain other protective compounds beyond the fiber itself. And, we really don't know. Okay, second thing, metabolic factors. childhood and adult obesity are strongly linked to early onset colorectal cancer. Each 5-unit BMI increase at age 18 was associated with a 20% increased risk. And obviously, the prevalence of obesity has grown markedly in the United States. 3, physical activity. Sedentary behavior is associated with increased risk, while physical activity reduces colon cancer risk by approximately 30%. Okay, that's huge. So just exercising lowers it that much. So, given what we know, what are the emerging risk factors? Well, gut microbiome alterations, particularly two bacteria, Fusobacterium nucleatum and Colibacterium producing E. coli, microplastic exposure, early life exposure, so maternal obesity, antibiotics during pregnancy, and circadian rhythm disruptions are under investigation. So, what are the future implications? Well, clearly, without effective interventions, the aging of high risk birth cohorts, so those born after 1950, could reverse decades of progress. And obviously, there's already evident in the plateau incidence rates among middle aged adults, which, as I said earlier, are between 50 to 64 years of age since 2011. As these high risk cohorts age into traditional screening ages. By 2030, early onset colorectal cancer is projected to continue rising, particularly in the 25 to 54 age group, while older populations will continue to see decreases. Okay, I know that's a lot of information. Hope you learned something. Thank you so much for listening. For more information, guidance, advocacy, or a consultation, you can go to my website at www.paladinmds.com and have a great day.